everyone, my name is Rachel Weldon, and today we'll be looking at nutrition and children with disabilities. So let's get started. Nutrition, what is it? Nutrition involves the studying of food groups and the nutritional components that are related to biological processes in relation to human growth and development. Factors that determine a child's nutritional needs are age, activity level, medical background, and genetics. For children with disabilities, nutrition disorders may not always be easily determined. So let's get started. A normal diet for a typically developing child usually provides all the needed protein, fat, carbohydrates, vitamins, and minerals that are essential for growth and development. Yet nutrition and diet can be a challenging aspect for a child with disabilities. Specific diet restrictions or adaptations can result in nutritional shortages, and the greatest nutritional impact is usually during infancy and childhood. During this time, the body is actively developing, yet for individuals with disabilities, the need for medical nutritional therapy can be a lifelong process. So what is medical nutritional therapy? Medical nutritional therapy is the manipulation of nutrients and dietary components to affect a disease or condition. Basically, it is the adaptation therapy plan that allows each child to receive the proper nutrients for their specific disability. So next, we're going to look at some common nutritional issues for children with disabilities. Children with disabilities deal with similar nutritional issues as typically developing children, such as the risk of becoming overweight, underweight, being picky or selective about their diet, and also dealing with control issues between the parents. Children with disabilities are often more likely to have concerns that are more serious, as well as various problems that could be related to oral motor skills, medical issues, and selective food disputes. Due to the nutrition aspects being more complex, diets should be specifically created to specific conditions or the disability for each child. So next, we're going to look at some of the nutritional concerns. So the first would be obesity, which is caused due to an excess energy intake in comparison to energy expenditure. Obesity is usually defined by having a BMI greater than the 95th percentile. Undernutrition, and this issue is actually more common in children with disabilities. Increased nutrients are usually seen in children with conditions such as cystic fibrosis and cerebral palsy. In the case of undernutrition, this is when medical therapy is often needed. Disability and stature. Usually an important measure of appropriate nutrient consumption is adequate growth. Unfortunately, many developmental disabilities are associated with atypical growth. Therefore, it can be difficult to determine if the child with disabilities and atypical growth is truly undernourished. Providing extra calories in these situations and for these conditions that are associated with short stature can actually lead to obesity. And in order to promote linear growth for the child, the treatment of hormone therapy may be needed. The picture below also shows what side effects that having any of these nutrition issues also affect the child's life, such as unsatisfactory body shape, feeling sluggish throughout their day, also facing the possibility of being teased or rejected by classmates, friends, or even family. There may be a decline in their exercise performance or activity levels, and they have the greater risk of joint injury, especially in the knees. There are also eating limitations. This could be due to the lack of appetite or physical limitations that are a big concern. Some children may be unable to eat due to fatigue, and this could be caused by neuromuscular disorders or disabilities. Some disabilities can cause difficulty with chewing or swallowing, and children that are on the autism spectrum may have restricted food preferences, whether it's due to the texture, color, or taste of the food. Children with autism tend to have a decreased variability in their diet due to these preferences. Being able to recognize undernutrition and malnutrition can be extremely difficult because activity levels and appropriate nutritional needs are often different than those of a typically developing child. So next, let's look at some nutritional support. And discussed before, the medical nutritional therapy is often needed for children with disabilities. And in order to properly set up a medical nutritional therapy plan, the child needs to go through a nutritional assessment, and a care plan is created that is specific for the child. The assessment is the first tool of documenting the child's nutritional status. If the nutritional status is not good, then recommendations will be determined. The next step is the nutrition care plan. This part is where recommendations are further explained. A nutrition care plan addresses the role of food in the family, such as snack patterns, food choices, and food preparation. So next we're going to look at types of different feeding options. Nutrition support often contains nutrients at high levels to accommodate the nutritional recommendations that are developed in the MNT. This form of delivery separates the nutrients and sends them straight to the gastrointestinal tract, or sends the nutrients parenterally, which means directly to the bloodstream. Most common disabilities that require this form of nutritional support include cerebral palsy, uncontrolled seizure disorders, or progressive neurological disorders. And the picture at the bottom displays the difference between the gastrointestinal tract, or the tract that leads them directly to the bloodstream, and you can see where the nutrient bags are connected into the body. There is also the need for support formulas. Formulas are available as food replacement options. Formulas differ in specific nutrients, caloric density, and administration technique. The goal is still to maintain a regular food diet plan and work to minimize relying on nutritional supplements. Using formula can be difficult for specific conditions such as Rett syndrome or cerebral palsy. So next we're going to look at more nutritional concerns, and this is table 8.8, which you can find in your textbook. So these are common nutritional concerns for developmental disabilities. First, we'll look at the nutritional problems that are likely in the first 3 years. And this could range anywhere from formula changes to accommodate different medical problems, delayed self-feeding, the rate of growth corrected for preterm birth, difficulty with setting feeding schedules, variable appetite, especially with the different illness, and gastrointestinal problems such as constipation. When looking at neuromuscular disorders, these children may have difficulty gaining weight, particularly with frequent illness, underweight with small amounts of muscle mass, short stature, constipation which may or may not be alleviated with dietary fibers, feeding problems such as swallowing, incoordination limiting food types, and need to consider supplementation. Next is developmental delays or intellectual disabilities such as Down syndrome. And children with these intellectual disabilities may face unusual growth patterns, underweight or overweight, unusual levels of activity, either higher or lower than typically developing children, delayed self-feeding skills, self-restricted diets, difficulty identifying hunger or fullness, and constipation, which again may or may not be alleviated with dietary fibers. Next, we'll look at attention deficit or hyperactivity disorders. And these children may face the inability to sit long enough to eat a meal. They get distracted and could interfere with eating. The lack of structure during meal times and snack patterns. Possible decreased appetite as medication is a big side effect. And difficulty with socializing at their meals. The last nutrition concern we're going to look at is epilepsy, which a growth plateau is likely even if they're eating well. Possible changes in appetite as medication affects appetite. A post-seizure state is likely to interfere with meals and energy intake. And lastly, unusual growth patterns in children with poorly controlled seizures. Next, we'll look at dietary recommendations and concerns. So the use for therapeutic diets may be needed. The ketogenic diet can be used for children with intractable epilepsy. These types of diet do require very close monitoring. The concern for food allergies. The concerns about various food allergies in relation to chronic illness Poor nutritional outcomes can occur in children with food allergies due to the restrictions that could impact nutrition intake. And also gastrointestinal dysfunction, which you could see at the table in the previous slide. A lot of nutrition concerns for children with disabilities include gastrointestinal dysfunction. And this could be constipation, and if it's refractory, it could be to a routine diet, can be treated with medications, or there's a variety of laxatives that show effectiveness to prevent impaction, discomfort, or even constipation that could lead to anorexia. And there's also self-restriction, which is a common issue for children on the autism spectrum, because most common issues are the food refusal and selectivity due to the food texture, color, taste, or their oral motor delay. So for my last couple minutes of the slide, we're actually going to look at a family and how they dealt with the nutrition for their child. Her name is Jasmine, that has cerebral palsy, and we're going to look at the steps this family needed to take in order to increase the nutrition intake and see what worked best to make sure that their child was developing appropriately.
Hi, my name is Serena and I'm a nutritionist, otherwise known as a dietitian. Good nutrition is especially important for children with cerebral palsy to make sure they are healthy and can achieve growth to their full potential. Nutrition is especially trained to support children and their parents with the many things that may affect their nutrition. These can include chewing or swallowing difficulties, very high energy requirements due to spasticity or seizures, food sensitivity, and constipation. To help children grow and feel good, nutritionists may talk through dietary suggestions to help with their particular need.
The nutritionist was helping us along trying to put some calories on Jasmine. She just wasn't eating enough to. She was burning off the calories she was eating. She wasn't putting on any weight at all. For like 2 years, she stayed the same weight. She was looking horrible. She was. You could see her ribs, and she was picking up bugs really easily, taking a long time to get over. It just was not healthy. So it came to the stage where the nutritionist said, well, look, there's nothing else we can do. She needs the gastrostomy button put in.
In Jasmine's situation, for many years, she struggled to eat or drink enough nutrition to grow properly or to feel her best. With guidance, she attempted a high-energy diet for a number of years. As is sometimes the case, extra help was needed, and in Jasmine's case, alternative nutrition support was the best option. As well as eating, Jasmine has a gastrostomy button, which is used to give her a formula. This formula is a nutrition top-up and gives her all of the extra nutrition she needs to grow and develop to her full potential.
It's been alright. She has been sore. Her main she has a constant feed goes through her overnight, and just have a machine that just pumps it slowly throughout while she sleeps. And it just gives her that extra nutrition, that extra bulk to what she wasn't getting. She still eats orally during the day, snacks here and there, but now it's not a major stress attack because she's not eating on her routine or not eating all the time. Now we can relax and say, well, eat what you can sort of thing, and don't have to worry anymore. And she's put on a good 9 kilos. She's grown about 7 centimetres.
Probably the most beneficial thing is her not getting sick as often and getting rid of it, but also after a day at school, she's still got energy to play at home. Whereas before she was worn out after school, she was just so flat, and when she got home she wanted to have a nap or more tea, so now she's got more energy than last day, which is a lot easier.
She looks healthy now, she looks so much better.
So as you can see, some disabilities require the medical nutritional therapy to make sure that the child is getting the correct amount of vitamins, minerals, and nutrients. And having these medical nutritional therapies can also help improve the child's quality of life. As you can see, Jasmine's parents said she was able to come home and still have energy to play with her friends because she was receiving the feeding tube. I wanted to thank you all for watching my presentation. I hope everyone was able to learn something new. And I also hope that the worksheet was helpful and not too terrible. Thanks again, and I look forward to reading everyone's questions and also watching everyone's videos.